my name is Melissa and I'm one of the nurses here at Union Pines Surgery Center. In this last video, we're going to discuss what you can expect after surgery. Before you leave the surgery center, a nurse will discuss with both you and your caregiver your discharge instructions. Your handbook is also a great reference for instructions, especially those for physical therapy and home medical equipment. Physical therapy and home medical equipment will vary from patient to patient based on your physician's individual plan for you. If you don't know your plan for therapy, please contact your physician's office. Now, once you're home, there are some steps you can take to ensure that you have the best possible recovery. One of these is blood clot prevention. Your physician will prescribe for you a blood thinner. The purpose of this is to prevent blood clots. Your job is to simply take this medication as prescribed. Do not stop until your physician instructs you to do so. When you're taking a blood thinner, there are some possible side effects we want to discuss with you. Bleeding that does not stop, vomit that looks like blood or coffee grounds, increased risk for bruising, red or dark brown urine, red, black, or tarry stools, unexplained pain or swelling, sudden onset of a severe headache, abdominal pain. If you experience any severe headache, abdominal pain, or bleeding that you cannot stop, you need to seek emergency medical attention immediately. For other concerns, please contact your physician's office immediately and follow the instructions they provide. Along with monitoring for side effects, there are some simple safety measures to follow while on blood thinners. These include: use a soft bristle toothbrush. Know that you will bruise easier than usual. Do your best to avoid injury. If taking aspirin as an anticoagulant, avoid taking additional doses of over-the-counter anti-inflammatories or aspirin. Do not stop your blood thinner until the time instructed by your physician. Patients taking any kind of blood thinner, avoid alcohol and herbal or green teas. Patients who are taking Coumadin or warfarin, do not make changes to your daily vitamin K intake via diet or vitamins. And know that when you are taking warfarin or Coumadin, you will have a weekly lab draw to monitor the effectiveness of the medication. In addition to taking your medication, one of the most important things that you can do to prevent blood clots is move. Your physical therapist will provide you with some post-operative exercises. Follow their instructions. Along with these exercises, make sure you get up and you walk hourly during waking hours. This can include going to the bathroom or simply to the kitchen for a glass of water. Just make sure you're mobile. Now, if you've had a total hip replacement, you may have some specific precautions for that procedure. These will differ by physician based on their method of surgery. Your physical therapist or nurse at the surgery center will discuss specific precautions that apply to you. Just be sure that you understand these precautions before you leave the facility and that you follow these at home. Pain control is another important component of recovery. Your physician will provide pain medication for you prior to you leaving the surgery center. Take this medication as prescribed. Along with consistently taking your pain medication, be sure to change position frequently and use ice at the surgery site as instructed by your discharge nurse. The ice and position change will help to reduce pain. Although your appetite may be low post-surgery, it is important you are eating well-balanced meals high in vitamin C to promote healing. Make sure to drink plenty of water and incorporate a stool softener into your daily routine. Colace is an inexpensive over-the-counter option that can help prevent constipation due to the use of pain medication. Milk of magnesia may also be used if necessary. Keep your incision clean and dry at all times, and be sure to follow the instructions provided by your surgeon regarding your dressing. Pay attention to your discharge instructions. Watch for signs and symptoms of infection at the incision site, such as drainage, redness, pain, odor. Please note, some redness, pain, or heat can be normal. Your discharge nurse will educate you on what is abnormal and when to contact your physician. Finally, one of the most important things to do in your post-op recovery is avoid falls. Do not stop using your walker until directed to do so by your therapist or physician. During the recovery process, there may be times your muscles don't react as you would anticipate. Therefore, a walker is needed to ensure your safety at all times. Along with consistent use of your walker, make sure you have all throw rugs removed from your floor, lighting in the home is bright, walkways are free of clutter, and pets are well controlled. Please be sure to review your handbook prior to your day of surgery. Our staff is happy to answer questions that may come to your mind as you review your handbook. It is truly our desire to help you get back to the activities that you love. Thank you for watching this post-operative video. We look forward to helping you move your life forward.